Queensland, and good morning to our Facebook Live followers. So our Chief Health Officer will give some more details, but today we have 59 new cases, and of course this is exactly what we expect Queensland. We expect to see more and more cases coming up into Christmas and over New Year, but we are well prepared for this. We now have had 13,395 tests in the last 24 hours. 10,520 vaccines were administered by Queensland Health, and the good news is we are now at 89.67% first dose, and we are looking at 84.51% of eligible Queenslanders are fully vaccinated. We also have had 197,546 border passes issued. So again, you can see there's a lot of people who are reuniting with families and friends coming into the Christmas and New Year season. Can I thank Queenslanders for wearing their masks? This has been very encouraging. I attended the basketball yesterday and people were wearing their masks, coming off the public transport, going into the game and then leaving the game as well. And of course, out in shopping centres, it's mandated for people to wear masks. Now, the Chief Health Officer will talk a little bit more about this, but what we are saying today is that we strongly recommend that you wear your mask in an indoor setting. So we're not mandating it, but I will be wearing my mask when I go in and out of cafes or restaurants, and when you're sitting there you can take your mask off. This is just an added precaution until we get to that 90% fully vaccinated, but also too until we need Queenslanders to get their boosters. It's really important. If your boosters are due, please go and get your booster. You can get them now at 5 months, and if you are thinking, oh, it's coming up to Christmas and New Year and I haven't had my booster and I'm due, go and make some time to get it done, because the evidence around the world is actually saying that that additional booster shot is absolutely very important. So please go and do that. Okay, so I want to talk to you today too about some additional measures that our government is doing. So yesterday we announced 108 new paramedics, which is fantastic. So it's wonderful to see that we'll be having additional paramedics across our system. Now today I'm announcing an extra boost to Queensland Health, and that is an additional $200 million. As we enter this new phase of dealing with COVID and the pandemic, we will be dealing with more and more people in the home environment. We want to make sure that we have the best technology, we're giving people the best care possible, because a lot of this will be managed at home rather than our hospitals unless people are seriously ill. My understanding is at the moment there is only one person who is ill, seriously ill with COVID. They are not in ICU. And of course, it's going to be very interesting to monitor how these rates go over the next few weeks and into the months. But the extra $200 million is an injection. We had very good results with our MIFA. We had extra money from stamp duty and extra money from coal royalties, and I believe that this is a necessary step to make sure that health has that extra money there. This is already on top of the $22 billion in the health budget, so that's some good news. I'm also announcing today another boost for Queensland Health, and that is a new Chief Operating Officer for Queensland Health. Sean Drummond is a former Chief Executive of Metro North and Metro South HHS. He'll be working in close partnership with the Director General, focusing on operational delivery. So essentially, he will be managing the hospitals right throughout Queensland. This is an extra boost to Queensland Health, and this is similar to a model that is operating in New Zealand. So look, I'll hand over to our Chief Health Officer, and then our Deputy Commissioner will update you about the border passes. Thanks.
Thank you very much, Premier. So today in Queensland we have 59 new cases to report. This is consistent with what we've been seeing over the past week, where we're seeing roughly a doubling in the number of cases every 48 hours roughly. So we do expect the cases to increase significantly, and the trend has continued, as we head into January. Again, I have been speaking with doctors across the state looking after these patients, and again, we just had the one moderately unwell patient in one hospital who is improving, I was told last night, and she was not vaccinated. Having said that, our case numbers are still small. It's only a couple of hundred cases over the past week. And we know that people are most likely to get seriously ill in the second week of their illness. So it will be very instructive to learn in the next 1 to 2 weeks what pattern we see in the hospitals. There is no one in intensive care in the hospitals at the moment. So that brings the total number of cases in Queensland to 2,356, with 197 cases currently active. 13,395 COVID-19 tests were completed yesterday. 10,520 vaccinations were performed by Queensland Health yesterday. And as you've heard, our double-dose vaccination rate is at 89.67%, with a single-dose vaccination rate of 84.51. In terms of the source of acquisition of infection in these cases, with the increasing numbers of cases, it does get harder for the public health units to trace patients, their movements, and find out exactly where they're acquired their infections. So it takes a little longer. We have 33 cases that are currently under investigation, 1 case overseas acquired, 16 linked to interstate travel, and 16 are contacts of known cases. In terms of the locations of cases, very similar to what we've seen in the past few days, including Brisbane, South and North, Gold Coast, Sunshine Coast, Toowoomba region and Townsville. In terms of the Omicron strain, Omicron is clearly becoming dominant in Queensland. We've had 43 confirmed Omicron cases in Queensland so far, and of those tested yesterday, there were 13 Omicron cases and 8 Delta cases. Those are the virus isolates that were tested. So you'll recall that the testing of these virus isolates occurs a few days after the cases are reported. There are 66 patients in hospital, but of those 66 patients, only one of them is there for medical reasons. There are other reasons why patients might be in hospital with COVID-19, such as isolating them from sick relatives, etc. We are increasingly managing patients with COVID-19 in their homes, and quite a number of patients have been shifted to home care in the last few days. In fact, there are 32 cases currently being cared for in their home or in another suitable residence. I do want to make mention of one cluster outbreak of concern. We will see increasing numbers of clusters and outbreaks in the coming weeks and months. This is not unexpected, but I will mention this particular one. It's a cluster of cases related to a graduation ceremony of nurses and paramedics that occurred last Monday at the Brisbane Convention and Exhibition Centre. These were Griffith University students. Details of this event have been posted on our website since Thursday the 16th. We have assessed the whole event from 7:30 a.m. to 12:30 p.m. as a casual contact event, and we ask people who are at the event to get tested and isolate until they receive a negative result. We also ask anyone who was at the convention centre but not actually at the event to get tested, but they don't have to isolate themselves. So these attendees included nurses, paramedics, paramedic graduates and other clinical disciplines. A total of 2,675 people attended that event. We so far have 15 cases linked to that event, but we expect more. Some of these cases have been identified as Omicron, so it's likely that the whole episode will be an Omicron cluster. Thank you very much.
Morning. Our operational tempo is quite high at the moment. Since the borders opened last week, we've seen 195,856 passes for people coming out of border passes for people coming out of the hotspot areas. That gives you an indication of the type of flows that we are seeing. Of course, we don't know the exact numbers that travel, but I can tell you that yesterday we intercepted 36,314 vehicles at our borders and turned around 199 and placed 8 persons into quarantine. At our air borders, domestic, 8,521 persons were processed, 40 were refused entry and 15 placed into quarantine. As you've heard the Premier say, we've seen some very good compliance in a number of areas in relation to masks. Nonetheless, we are seeing some areas are not consistently wearing masks. So the message goes to all Queenslanders, not just those in higher density areas, that you are required to wear masks under certain conditions. Yesterday we handed out 172 masks and had to take action against 2 persons, one for not wearing a mask, who was given an on-the-spot fine at Howard, and another person, regrettably, had to be arrested because when challenged by police for not wearing a mask in a IGA at Nanganango, took it upon herself to seriously assault the police, attempt to bite them and strangle a dog, and that person has been charged with serious offences of animal cruelty, serious assault against police, as well as breaching the Chief Health Officer's directions. The message is quite clear. Our police officers will give you the opportunity to comply with the directions. Take that opportunity, take the mask, wear it. Better still, carry the mask and wear it when you need to. We will be out and about. If we are concerned about the levels of compliance, we will look at taking more enforcement action. Businesses, we checked 334 yesterday, no issues with them. Thank you to the businesses working hard. Yes, there has been some confusion, but we are able to work through that with them, and we are seeing very good compliance coming out of our businesses. And 48 calls of service in relation to persons who are unvaccinated, and 61 in relation to businesses where there were concerns about. We were able to work through all of those and no issues arising from those. So the final message, of course, is that stay across what the directions are and what the current requirements are. We will try to work with you, but we really do need to see this high level of compliance that we want to see so that we don't have to take enforcement action. Thank you.
We're happy to take some questions.
We're seeing skyrocketing cases in the Northern Hemisphere and in New South Wales, including increasing hospital admissions. How is it okay to stick to a plan that was made before Omicron?
Well, what we're seeing in the northern, I might get the Chief Health Officer to talk about this, but they're actually entering into a winter period where it's even more contagious because people are indoors. What we're asking people to do now is, at their discretion, think about wearing masks when they're going into entertainment facilities such as cinemas, theatres, also to when they are going into cafes and bars and restaurants, and then removing that mask when they're seated. Queenslanders have done this. This is nothing new for Queenslanders before, and I'm quite sure that we can all do it again. In fact, going into work today, there were many people wearing their masks going into 1 William Street as well. So people are wearing their masks, and like I said to you yesterday, going in and out of the Nissan Arena for the basketball, people were doing that as well. What we also know is that we are waiting on further advice from the Commonwealth Government, and I will also defer to the Prime Minister and the Chief Medical Officer, Dr. Kelly, to give the updates to the public about that. But we also know that masks are a preventative measure, but also too, vaccines are really important. What the Chief Health Officer has said is that the person who was ill in hospital was unvaccinated. What we're seeing in New South Wales and other parts around the world, that this is the pandemic of the unvaccinated. So if you are unvaccinated, now is the time to line up and go and get your vaccine. It is also important to get your booster shot. So if you are eligible, you've reached that 5-month mark, please go and get your booster shot. Go and see a local GP, come to one of our centres, but please go and get your booster shot.
The 200 million, is that just throwing money at a problem rather than fixing?
No, it's not, because what we do know, Claire, is that we have put around $2 billion into COVID in Queensland. We have done very well when it comes to our royalties and our stamp duty. This is an added measure. We know that we will see more and more people having to have their symptoms monitored at home with the new variant, and this is making sure that we have the extra money ready to go. It's basically having it there. It's ready to go for health to utilise when they need it.
Has there been revised modelling?
Well, can I say to people who are visiting our state, you know, we welcome you here, and it's great to see a big boost for our tourism industry, but people should comply with going and getting their day 5. So can I say to anyone who is travelling into Queensland, it's not hard. I know many of the hotels are putting a list there of where you can go and get your testing. Please make sure you go and get that done. It is really important. It doesn't take long. Go and get your test, and then you can get on with the rest of your day and the rest of your holiday. Yeah, well, what I'd like to say to everyone is that we are welcoming you into our state, and we would really like people to do the right thing.
Premier, have you considered easing the 72-hour PCR test window for people coming up from down south?
No, not at the moment. Queenslanders feel that added measure of safety, knowing that people are getting that test coming into Queensland. But we know that this variant is highly contagious. It's sweeping across the world, and it will become the dominant variant across Australia. But we also know that that having the vaccine prevents severe illness, and we also know that masks help to ease the spread as well.
Has there been
Considered easing
revised?
it though, like, because people might not go from Brisbane down to Sydney, for example, to see their family. If the test waiting period is blowing up to 56 hours.
Well, hopefully New South Wales will put on some additional testing clinics, maybe.
Has there been revised modelling on?
Yes. Look, I think everyone wants to have a safe Christmas, but we also know people want to see their families. This has been, and I've been at many press conferences where people have spoken at length about the heartache of people not being able to see one another. And Christmas, people are travelling right across the nation, except to Western Australia, to see their loved ones. And look, it's a small price to pay to go and get that test.
Has there been revised modelling?
Is the government monitoring that in any way, or is it just anecdotal?
Well, like what I say to people is, and from the evidence I've seen, is that people are lining up and going and getting their tests. So I don't have the figures on me.
Premier, the Transport Tourism Forum said that the 14-day post-contact isolation period remains deterrent for travel to the state of Queensland. Is there a consideration for
The 14 days?
Yes.
Well, it's set out on our plan. We actually made that very clear. But we're getting very close to that 90%. So, of course, that changes when we get to the 90%.
every other state except the WA, obviously?
Yeah. Well, we're having a look at that when we get to 90%.
Has there been revised
Queensland
modelling?
hasn't been declared a hotspot yet?
Sorry?
Is there a reason why Queensland or Brisbane hasn't been declared a hotspot yet, given the large numbers?
Look, we are going to see, Josh. And you've just come back from New South Wales, and you know what it's like down there. We are going to see more and more cases. Okay, this is what we have planned for. This is what the national plan is all about. This is what Scott Morrison has been talking about nearly every single day during this pandemic. And we know that there is a balance to get right here in terms of people seeing their loved ones, but also to managing the pressures on our hospital system. Now, thankfully, at the moment, and of course there needs to be more evidence, but we are not seeing that huge influx into our hospitals, but we are getting our hospitals prepared. We've been doing a lot of planning over the last 18 months, and now today I'm announcing an extra $200 million boost there to make sure that we can cater with the number of people who will be isolating at home if they get COVID.
Premier, has there been?
Well, you know, people, you know, may face fines. So I'm just saying to everyone, if you're coming to Queensland, well, the police administer that, not me. So what I'll say very clearly is, please go and get your day 5 tests.
Premier, has there been revised
Yes.
modelling, given Omicron, on the number of cases we can expect, the number of hospitalisations and the number of deaths?
I haven't seen that.
If you weren't you doing it, I think the Chief Health Officer said
I haven't personally seen it yet. Okay, so but what I can say is we are expecting to see increased numbers, but what we have seen from the evidence to date is that less people are having severe disease from this variant.
Too early though, isn't it, to say that?
Well, that's why I'm asking people today to please wear their masks.
How will frontline services hold up, even if people aren't too sick and blocking up ICU beds? How will frontline services hold up if thousands of people are quarantining and we've got hospital workers out, police, as we know, is happening today?
Yep, we're planning for all of this. We are very good at planning. We've been through cyclones, we've been through natural disasters, and our government has been preparing for this, and we have been undergoing a pandemic now for nearly 2 years, and Queenslanders have done a mighty job, and I thank everyone who's been involved.
How many people are in isolation at the moment?
Well, there'd be thousands of people, hundreds of people in isolation at the moment, and it's not uncommon. Go and have a look at what's happening around the world. This is what they do.
Premier, there are dozens of police officers isolating right now. Are you
Yes.
worried about the impact on policing services for DV during Christmas, things like that?
No, not at the moment. It might get the Deputy Commissioner to speak to that, but we have a meeting every morning where we talk about a whole range of issues, and the Police Commissioner assures me that there are enough staff.
How are check-in numbers? Is there a concern people want to check in that if we're going into isolation?
Look, I just say to people, in terms of contact tracing, it's still important that you check in. Look, this is a new world for Queensland. This is a new phase of the pandemic that we're entering, but it's one that reunites families. It's one that still continues to have our economy open, but it also means that our families and loved ones are able to get together for Christmas and New Year.
The numbers are still strong. You're happy with that?
Yep. People are still using their check-ins.
Can we ask you questions to Joe?
Yeah, sure.
Thank you. And everyone else.
Thank you.
I just wanted to ask you, I guess, about the wording that you used before. You didn't use it today, but you said that this spread is necessary of COVID. Why is it necessary?
It's necessary because this virus ultimately needs to become endemic in the community before we can move on. Eventually all of us will develop some degree of immunity to this virus, and probably the virus will become less virulent. That's the nature of how new viruses are introduced into the community. That's what's happened previously with influenza pandemics. The last major influenza pandemic in Australia was in 1968, and all of us will have been exposed to a variant of that virus during our lives, and we've dealt with it. That is the nature of how a virus goes from a pandemic phase to an endemic phase. The 1968 H3N2 influenza pandemic is now endemic. That is, it spreads regularly through the community. Every one of us has had it at some stage in our lives.
Has the updated modelling been done for Omicron, and will it be released?
There are various updated models, and there is no doubt there are substantial numbers of cases predicted in the coming weeks. We are working nationally with all the chief health officers and epidemiologists, and there is a plan formulated for dealing with the Omicron strain, and it focuses very heavily on the use of masks in public environments. Now, the mandates that we have placed on masks here in Queensland have been, I think, relatively gentle, but we ask you to go above and beyond what is mandated. So if you're going to a cinema, if you're going to a theatre, wear a mask, even though that is not necessarily mandated. So that is part of the national plan. Vaccination is also part of this national plan to deal with the Omicron strain, and particularly those people who have had, if it's been 5 months since their second dose of the vaccine, need to come along now and get that third dose of the vaccine. We're currently meeting almost every day to discuss it and moderate our response to Omicron. Part of the problem, of course, with Omicron is we are gaining little bits of information every day. The good news is it appears that the vaccines that we are using are effective in preventing severe disease. And in the end, that's what it's all about.
Doctor, any idea how these people became exposed to COVID at the Griffith graduation? Do you know where that stemmed from?
The original source, I'm not sure if it's known. I don't know. I am aware of, yes, I'm aware of at least one paramedic that has tested positive, yes. And I don't know if it was from that event. Look, we are seeing exposures in healthcare workers are like everybody else, and there are tens of thousands, hundreds of thousands of healthcare workers in Queensland. So it is inevitable that some of them will have been infected and will continue to get infected. We have a nationally agreed process for dealing with healthcare workers if they become infected to protect patients in the hospital environment. Paramedics, for example, of course they're all vaccinated, but they also now wear masks whenever they're seeing any patient, not just patients who are potentially infectious. It's routine for paramedics now to wear masks at all time as part of this national plan.
Should rapid antigen testing be used more widely as people are walking into hospitals or medical centres?
Again, this is something that is being looked at by this national group. As we all know, the problem with the rapid antigen test is it's not as sensitive as the PCR test. So we will miss some cases, but that will be part of the plan going forward as the case numbers increase. And that is being discussed actively every day nationally about when we introduce it and in what circumstance.
Sorry.
Go ahead.
There's a cluster around a camp on the Gold Coast where a number of children have been told that they have to go into quarantine over Christmas. Their families are saying, well, as of the 1st of January, they'll only have to do 7 days. Why do our kids have to do 14 days over Christmas? I guess, what's your thoughts on that as the risk profile of that? Even 5 days later, they will.
We are actively looking at the whole quarantine and isolation process on a daily basis.
Any idea of how many police officers might have contracted it in that cluster, the Logan/?
I don't know those numbers. Perhaps our police commissioner can help us there.
With the 59 cases today, can
Yes.
you just confirm how many were in the community acquired?
I don't think I've actually got those data. Look, most people are now in the community. Look, you just have to assume that the virus is everywhere. And particularly with vaccinated people, they're getting very mild symptoms, and which is great, but it also means that they often don't know that they're actually carrying the virus, and it's true that they can be contagious. But the virus is protecting them against severe disease, which is even a bigger reason why we all need to get vaccinated.
There's something like 400 contact tracing sites up on the Queensland Health website. It's almost impossible to go through all of them and take it all in. Should people just be relying on checking in and being contacted if they've been somewhere?
Oh, we do want people still to check that site regularly, every day if possible, to make sure that whether they have been to one of those sites. So we'd like people to check at least every day on those sites. Yes, you're right, there are a lot of contact sites at the moment.
Are contact tracers
On the police officers. Just a couple more questions, and if you had one as well, but I guess given there are 400 contact tracing sites, there are almost 200,000 people that are coming in that should have got their day 5 test, and there were only, was it 16 or 13,000 people that got tested yesterday. Are people doing the right thing? Are you worried that there's a lot of COVID that's slipping through the cracks here?
Oh no, I think people are doing the right thing. I mean, you just have to walk around and see people wearing masks in places, for example, where they are not mandated to. That's what we want to see. That's exactly what we want to see. We want people to be proactively wearing masks, even if it's not in the mandate. And I think people want to do that. I think people want to do the right thing.
Are you monitoring the number of people who come from interstate that get day 5 tests? Is that something that you monitor?
It's not something we are actively monitoring. We are relying on the good. We are relying on the goodwill of the people. Well, it's. That is not the main. Okay, so the main thing is we want people who have symptoms to come forward and be tested. This is not going to be the main source of infection in Queensland. The virus is already here, and it has nothing to do with the 5-day testing. The virus is in the community. We know that. The Omicron strain has changed a lot. We did not expect. So the Omicron strain is far more contagious than the Delta strain, and the speed with which this epidemic is spreading is beyond what had previously been expected.
To monitor the level of COVID testing for people travelling from the southern state hotspots. Surely that makes sense. Is that the expectation?
The virus is in the community. It is widespread right down the coast of east coast of Queensland and inland. It is here, and that is the message. The message is it is here, and we need to approach our lives as such.
The police don't have a clue whether there's no requirement on the border pass application to prove you've had that day 5 test. Is there any box that has to be ticked to say yes, I've had it done?
It is not the most important aspect of the public health measures at the moment. The most important thing is that people are symptomatic, that they get tested.
Described by the Health Minister all the same. Very important. Maybe not the most important, but very important.
Well, we hope that people do.
You don't know how many thousands of people are wandering around there without a day 5 test. The police have no idea. How can you convince people that this is nothing other than a shambles?
At this stage, it is not the most important aspect of the public health response. It is a minor aspect of the public health response.
The Health Minister, she described it to us as very important. That was on 6th of December when the Premier announced penalties for people who fail to get the test. Now, it's pretty straightforward. It creates a fairly...
The lack of the 5-day test is not the reason why the Omicron strain is spreading through Queensland. It has nothing to do with that.
Yeah, Deputy
If we can
Commissioner.
ask you about the
Yes.
policing on the...
Steve?
Are there gaps in the policing network given how many officers, do you know how many officers?
Gaps in the... So you're referring to the Gold Coast and Logan, where we've had 2 separate cases. So we have 2 positive cases on the Gold Coast, 52 officers in isolation at present, and 1 case confirmed at Logan District with 49 in isolation. Now, I'm assured, talking to the Assistant Commissioner there this morning, our business continuity planning is sound. We can accommodate more than that. We have planned for this, as the Premier said. We've been planning for this right across government, right throughout the pandemic, expecting it to happen at some stage. It's taken nearly 2 years for it to happen, but we've expected this. So our plan is pretty solid. I'm comfortable where that is at the moment. We will continue to monitor that. If we see any pressures on Gold Coast, for instance, we'll bring police in from other areas. We have the flexibility to do that. But of course, we will continue to monitor that and see where it goes.
Even during Christmas, DV...
Absolutely. We had up to 1,300 officers tied up in COVID at peak during the pandemic, and currently we're under 500 per day. I'm talking about, Josh. We're currently under 500 a day, so we have the flexibility there. Of course, we're working hard. We're working very hard right across all the things that we do in policing to make sure we get this right. But we're not sitting here waiting for things to happen. We have been planning for this.
Have any businesses been fined for not complying with the check-in rules and the vaccination rules?
We have over the whole pandemic. Nothing in the last few days, but so I should mention I've been through 5-day testing. So I have just come back to work, and I've been monitoring it anyway, but we have not seen any fines given at this stage. What we take throughout the pandemic, particularly when we're changing systems as we are now, is give people a chance to comply with the system, to understand what's required of them and work with them. So as you heard me say earlier, we had 61 businesses that we had calls for service about. We went and spoke to those businesses, they complied, we achieved what we needed to achieve, we didn't need to fine anyone. Those that do the wrong thing willfully can expect to get fined.
Have you been checking on some of those high-profile businesses that have said they won't comply?
Yes, there's some investigations underway at the moment. There's one in Toowoomba, for instance, that's been given a penalty infringement notice that was quite vocal about their views around this. The law's really clear. The directions are in play. If people are going to willfully disobey them, they can expect enforcement action to be taken.
How much is that fine?
For a business, I think it's over $6,000.
Yes, it's a new position. It's similar to the New Zealand model, and it's an extra additional boost to Queensland Health. It's one that I've discussed with the Health Minister and with the Director General, and I believe it's going to give that extra firepower to health. Okay.
We understand that's health
It's all been ticked off by the Integrity Commissioner, and everything is fine. Okay. Thanks everyone. Now I'm going to get my booster. All right, let's go.